Let us talk about what it actually takes to become a Surgeon General. Traditionally, this role has been filled by physicians with decades of clinical experience, board certifications, and active medical licenses. These are doctors who have spent years treating patients, navigating complex medical systems, and earning the trust of the medical community. Casey Means took a different path. She graduated from Stanford School of Medicine in 2014, which is an accomplishment worth acknowledging. Stanford is a prestigious institution, and earning a medical degree there is no small feat, but that's where the traditional trajectory ends. Means began a surgical residency in head and neck surgery at Oregon Health and Science University. This is a demanding 5-year program that trains surgeons to operate on some of the most complex and delicate areas of the human body. She dropped out before completing her final year. On her website, she explained that she left because she saw how broken the healthcare system was and wanted to focus on keeping people out of the operating room. That's a reasonable personal choice, but it means she never finished the training required to become a board-certified surgeon here. What that means in practical terms: she is not board-certified in any medical specialty. Board certification is the standard way physicians demonstrate expertise in their chosen field. It requires completing residency and passing rigorous exams. Without it, a physician cannot practice independently in most hospitals. Her medical license tells a similar story. Her MD license was granted in 2014, but she shifted it to inactive status in 2019. An inactive license means she cannot legally practice medicine or prescribe medications. She has not treated patients in years. Previous surgeons general have typically been career public health officials, practicing physicians, or both. They brought decades of hands-on medical experience to the role. Means brings something different. She has built her career primarily as a wellness influencer and entrepreneur in the digital health space. This raises a fundamental question about whether the nation's top doctor should have ever actually practiced medicine. So what do you do when you walk away from a surgical career in your final year of training? If you are Casey Means, you reinvent yourself entirely after leaving her residency at Oregon Health and Science University. Means did not pursue another medical specialty or seek employment at a hospital or clinic. Instead, she pivoted hard into the wellness industry. She began describing herself as a metabolic health evangelist, a phrase that sounds almost religious in its conviction. In 2019, she co-founded a company called Levels, which markets continuous glucose monitors directly to consumers. The pitch is compelling on its surface, where a device tracks your blood sugar responses to different foods and optimize your diet based on personalized data. It is the kind of tech-forward wellness product that attracts venture capital and builds devoted online followings. And build a following she did. Means became a prominent voice in online wellness circles, amassing hundreds of thousands of followers across social media platforms. She wrote newsletters, appeared on podcasts, and positioned herself as someone who had seen the broken healthcare system from the inside and chosen to opt out. Her stated rationale was that traditional medicine was too focused on treating disease rather than preventing it. She called the healthcare system broken and exploitative. This narrative resonated deeply with people frustrated by rushed doctor visits and expensive treatments. But here is the question that hangs over this career transformation. Does building a wellness brand qualify someone to be the nation's top doctor? The Surgeon General role has traditionally been held by career public health officials, people who spent decades in government service, academic medicine, or public health institutions, Means took a different path entirely. She became an entrepreneur and influencer, building a personal brand and a for-profit company. That trajectory raises fundamental questions about what expertise means in public health leadership. The path to this nomination becomes much clearer when you look at who helped open the door. Casey Means and her brother Callie Means worked as key advisors on Robert F. Kennedy Jr.'s 2024 presidential campaign. They positioned themselves as prominent voices in what became known as the Make America Healthy Again movement, or MAHA. This movement became a central pillar of the Trump administration's health policy approach. This political partnership matters enormously. Kennedy has a well-documented history of spreading vaccine misinformation. He has repeatedly claimed that vaccines cause autism, a theory that has been thoroughly debunked by the scientific community. He has questioned whether flu vaccines actually prevent hospitalizations, contradicting established public health research. During her Senate confirmation hearing, Means was asked directly whether she agreed with Kennedy's claims about flu vaccines. She declined to give a straight answer when Senator Bill Cassidy, a physician himself, pressed her on whether she would encourage parents to vaccinate their children with routine shots like the measles, mumps, and rubella vaccine. Means would not give a simple yes or no. She spoke instead about patient autonomy and conversations with pediatricians. This happened while measles outbreaks were spreading across the country. The concern from public health experts is straightforward. The Surgeon General is supposed to be the nation's leading voice on public health guidance. But what happens when that person owes their position to a political alliance with someone who has spent years undermining confidence in vaccines? Bernie Sanders expressed serious concerns about whether Means could push back against Kennedy's misinformation. Her responses during the hearing did little to reassure critics. The nomination appears to be less about medical qualifications and more about rewarding political loyalty. Picture the room. A Senate confirmation hearing. The nominee for the nation's top doctor position sits before the committee, and a straightforward question lands from Senator Bill Cassidy himself. A physician: would you encourage parents to vaccinate their children with routine shots like the measles, mumps, and rubella vaccine? This should be an easy yes for anyone nominated to lead public health messaging. But Casey Means did not give a yes. She offered something far more complicated. She said she supported vaccination, then immediately pivoted to patient autonomy and conversations with pediatricians. When pressed again, she repeated the same formulation: support for vaccines, but always filtered through individual choice and doctor discussions. Here is why this matters enormously. Measles outbreaks were actively spreading across the country. At that very moment, South Carolina was experiencing its worst outbreak in over 3 decades. Childhood immunization rates had been declining. This was not a theoretical policy debate happening in a vacuum. Children were getting sick. The Surgeon General's primary job is communicating clear, actionable health guidance to the American public, not suggesting people have conversations, not emphasizing autonomy above all else, giving people the best available science in language they can understand and act upon. Even Mehmet Oz, running Medicare and Medicaid services under the same administration, had issued a direct plea: take the vaccine, please. That is what a public health official sounds like when disease is spreading. The hepatitis B question revealed the same pattern. Senator Cassidy, a liver specialist who had treated hepatitis patients for decades, asked whether universal immunization was an important goal. Means called it an important recommendation at some time in childhood. not for newborns, specifically not as a clear endorsement of CDC guidance when Senator Tim Kaine pressed her on whether she agreed with Kennedy's claim that flu vaccines lack evidence for preventing hospitalization. She would not answer directly. She acknowledged the shot could prevent severe illness at a population level. Eventually, after repeated questioning, this is not navigating complexity. This is avoiding clarity, when clarity is literally the job description. Let us zero in on one of the most striking moments from that confirmation. Hearing the exchange over the hepatitis B vaccine. Hepatitis B is a liver infection that can become chronic and lead to serious complications, including liver cancer, for decades. The CDC has recommended that all newborns receive the hepatitis B vaccine within their first 24 hours of life. The reasoning is straightforward. This virus spreads through blood and body fluids, and infants who contract it face the highest risk of developing lifelong chronic infection. Senator Bill Cassidy, a Republican from Louisiana, happens to be a liver specialist. He has treated hepatitis patients for decades, so when he questioned Casey Means about universal immunization, he was speaking from real clinical experience. He asked her directly whether she believed universal immunization was an important goal. Her response was telling. She called it an important recommendation at some time in childhood, not on day one, not universally, just at some point. Then she went further. She said, the administration questions whether this vaccine is necessary for all children on the first day of life. Here is why that matters. The CDC recently scrapped its long-standing recommendation that all newborns receive the hepatitis B vaccine. That decision came from this same administration, and now their nominee for Surgeon General was echoing that position under oath. What makes this particularly concerning is that hepatitis B can be transmitted in ways parents might not expect without universal newborn vaccination. Children who are not considered high risk could still face exposure. The first dose given at birth creates a safety net that has protected generations of American infants. When a liver specialist asks a straightforward question about protecting newborns, the nation's top doctor should be able to give a straightforward answer. Instead, what the committee heard was hedging. Let us talk about money. Specifically, the money flowing through Casey Means' wellness empire, and what it means for her potential role as America's top doctor. Means co-founded a company called Levels, a for-profit digital health startup that sells continuous glucose monitors directly to consumers. The business model is straightforward. People pay to track their blood sugar responses to food, and the company profits from subscriptions. This is not inherently problematic, but it creates a direct financial interest in the wellness industry she would be regulating and advising on as Surgeon General. Here is where things get complicated. Means has built a massive following as a wellness influencer, with millions of people consuming her content about metabolic health, nutrition, and chronic disease. Her newsletter, social media presence, and brand partnerships all feed into this ecosystem. When she questions established public health guidance on vaccines or promotes skepticism about conventional medicine, she is speaking to an audience that trusts her as a medical authority, but she is also speaking to potential customers for her company and her brand. The Surgeon General's role requires impartial, evidence-based guidance. The person in this position is supposed to prioritize public health over profit, science over marketing, but Means has spent years building a business model that profits from wellness industry. Messaging her financial success is tied to a particular narrative about health, one that often positions itself in opposition to mainstream medicine. This raises uncomfortable questions. If confirmed, would Means recuse herself from decisions affecting the metabolic health industry? Would she disclose her financial interests when making recommendations? The American public deserves a Surgeon General whose only allegiance is to their health, not to a bottom line.